and welcome back to my YouTube channel. I am in a new setting for this coffee and questions because I just got through filming my VBAC class that is now available to you on my website. You can go to bundlebirth.com and find everything over there. I am so excited because I have a very soft spot in my heart for VBAC mamas. I want you to get that VBAC if you want it. And so I also want to set you up with the resources, tools, etc. that you need to get your VBAC. So go on over there, find my VBAC class over there. If you don't follow me on Instagram, I am currently having a Labor Day sale, and the only way to know about it is by following me on Instagram and watching my stories, because I am updating you over there all the time on my life, on the craziness happening, when I'm posting videos, etc, etc. This video is not sponsored by Starbucks. If you know me at all, I figured one of these coffee and questions I better have my standard venti Starbucks cup that I always carry around with me. If you've ever seen me in the public, you know that I probably will have a venti Starbucks with me at some point. Today, I am back for more of your questions from the comments and then from Instagram. If you don't subscribe yet, I would appreciate it if you click the red button and subscribe to my channel so that you never miss a future video. And then let's get started with your August coffee and questions. Usual, we're gonna go to Instagram. Ooh, herpes. All right, let's talk herpes, because I got like a good amount of herpes questions. I did talk about herpes in a previous coffee and question, so maybe this can become an FAQ. Speaking of, I do have a new series that I just started called FAQ, Frequently Asked Questions. So I'm taking your most common questions that I continue to get asked that I've already done in previous coffee and questions and making them into short little snippet videos. So another one of those will be coming at you real soon. And then I already have one up. You can check that out here on my channel. I'm not gonna say who it is, just out of confidentiality to them. But there are at least one person saying, I'm a first-time mom with HSV2 or HSV1 I see here with a genital ulcer, and they're waiting on the results. Do you have any advice? My advice is take a deep breath. And then somebody else asked me, should I take the meds? I would say yes, take the meds. Clearly listen to your doctor, but they're gonna give you a cyclovir typically to decrease your chance of a genital ulcer while you're giving birth. So really, it doesn't really matter that you have herpes unless you have an ulcer when you go into labor for birth, because if you do have an ulcer down there, then you can't deliver vaginally. Baby goes through that ulcer, gets the herpes all over them, they get super duper sick. Not cool. It would mean a C-section. You want to repress the virus with the medication so that you have less of a chance of having that lesion when you are delivering. If you want to know more about that, you can find that in a previous coffee and questions. I can link that down below, and then I'll turn that one into an FAQ at some point coming up. Joyce Aaliyah says, castor oil, does it work? Is it bad? I actually have seen this question a lot, and I don't know why I've avoided it, but in my mind I'm like, I don't want to talk about castor oil, but I'm talking about it today. We're doing it. Castor oil is basically an oil that you ingest. You take like spoonfuls sometimes of this oil when you're term. You're never taking it before term, meaning 37 weeks plus. And it, in theory, in the past has gotten people into labor. I would say from my experience, I have seen a few women that have done the castor oil thing and then they go into rip-roaring labor. The goal of castor oil is to actually cause massive diarrhea. So it's a laxative. The kind of theory behind it is that your intestines are close to your uterus. Your intestines start cramping up and freaking out on you, and then it stimulates the uterus, and then the uterus starts contracting. And so my same rule applies as with my Can You Induce Labor Naturally video, as with my How to Induce Labor Naturally video. I did not include castor oil in that video because there's actually risk related to it, and I'll talk about that in a second. But the idea would be if your body is close to going into labor, if it is brewing, it is near, then sometimes castor oil can be the little boost to get you there. Now, the risk is that because it makes you poop, it also makes the baby poop. And then the baby poops inside, which somebody did ask about meconium. I don't know who it is. The fluid should be clear when your water breaks, but sometimes the baby can poop inside. And when the baby poops inside, then their lungs, being full of the amniotic fluid, are now full of poopy amniotic fluid. And that, in theory, is okay when they're inside, but once the baby goes through the vagina, hopefully it smushes out a bunch of that fluid, and then they pop out into the outside world, and now they need to breathe oxygen. And so with that, if there's poopy fluid in their lungs, it can make breathing more difficult, more complicated for the baby. If the baby breathes in a ton of that poopy fluid or the fluid is super duper thick and poopy, you can imagine you have thick poop in your lungs, like you're not gonna breathe very well. Ideally, we want to avoid meconium. We want to avoid any kind of breathing issues for you or for baby. And so I am not going to recommend castor oil. You clearly can do whatever you want, but the risk is that baby poops inside and then you end up with a slew of potential complications right at the delivery. For labor, it doesn't make a difference. It doesn't necessarily mean you need a C-section, or it's not an indication for a C-section. It's just one of those hiccups that you would like to avoid if possible. Along those lines, Katie Poland says, how do you know if baby meconium aspirated or breathed in some of that fluid in utero other than decreased fetal movement? Honestly, meconium aspiration is not a thing until they come out. So if the baby pooped inside, it doesn't necessarily mean that anything will be wrong. Sometimes if the baby pooped inside, like without castor oil being a part of the picture, it can mean that there's been some distress, and so baby's been stressed out and that's why they pooped. And so if that's the case, it's not the poop that stressed them out, it's the stress that caused the poop. Decreased fetal movement would more be because of maybe a perfusion thing, which could equal to stress on the baby, which therefore could lead to meconium. If you have decreased fetal movement, to me, it is separate from meconium aspiration. You can't even really have meconium aspiration until the baby's out and then aspirates the meconium into their lungs or breathes in that meconium. The Chinchilla Warrior says, when is it too late to get an epidural? That's a very common question. It is too late when the baby's coming out of you. You have to ask your hospital this because different hospitals are gonna have different policies and protocols for when they'll administer an epidural. If your baby's not coming out of you and if you can hold still for the procedure, meaning hug a pillow like this, leaning over, not moving even when you have a contraction, then in theory, they can still do an epidural. I've done epidurals on women who are 10 centimeters. They've been pushing for a couple of hours and they're wiped out and baby's like maybe not coming down right or something. As long as you can hold still for it, in theory, you can still get an epidural, or that like I'm not gonna catch the baby between your legs when you're sitting up for your epidural. The other thing is that the epidural takes about 15-20 minutes to work if it's a standard epidural. And so if you're gonna deliver your baby within that 15 to 20 minutes, you might as well be doing what feels right rather than trying to hold still. And then by the time the baby comes out, then the medication kicks in and now you're numb when really like you felt everything for the delivery. So flex and flow on that one. For first time moms, I always say like you'll have time. Second, third, flex and flow. Hopefully you'll have time, but I would say if you plan on an epidural, once you get to the hospital, if you are in active labor, meaning 4, 5, 6 centimeters, you're planning on an epidural, just go for it so that you make sure that you have time for it. Caitlin Michelle says, can you relactate after 2 months of stopping breastfeeding or pumping? The answer is actually yes here. So you can relactate. There's actually protocol where even if you haven't had a baby, you can stimulate lactation. Mind you, you have to take like hormone injections and stuff. It's like a process to get you there. But if you've breastfed and then you stopped and then your milk dried up, there are ways to relactate. It takes some serious commitment and some serious work, but the answer is yes. I can put an example of how to relactate on my Instagram. So if you follow me on Instagram, I will do a post over there and it'll be about relactation eventually. So stay tuned over there and I'll tell you a little more about how to do that. But the answer is yes, you can with some work. Brittany Lebo says, what's your enneagram number? I'm a 7. Is that a surprise? Jennifer Hotvid says husband stitch. So a husband stitch is basically where if you tore a little bit and they're stitching you up, your doctor throws in a little extra zip on that vagina hole to make you a little bit tighter down there than maybe you were before because they're down there stitching you up. So it's for the husband. That's kind of where it comes from. So I mean, it happens. It is not a standard of care. There are some providers that will do it. If you really want your vagina to be extra tight down there, then you could potentially ask for it. The problem with it is, first of all, that your vagina is not broken. It will heal. It will go back to normal size. It heals actually very, very well together with just some stitches and even sometimes without. And so you don't really need the husband stitch. The other fear is that you do too much and then you actually have painful sex because the vagina is not quite as pliable and it's like too small / like too shut for your husband. So flex and flow on that one. Talk to your provider about what they do or don't do, and then Is it a thing? Not really, but does it happen? Yeah, it does. Truth Me 515 says top questions to ask during a labor and delivery tour for an African American mom. I'm gonna take this one, maybe not where you were going with it, but this is kind of how I interpret maybe the question. So a tour is basically you go to your hospital and you see what's up, you see what the facility looks like. You specifically mentioned for an African American mom, and that's where I'm triggered to think about the studies and the statistics about African American mom. We know that African American women are much more likely to have complications and to receive worse care, and actually they're 4 times more likely to die in childbirth. We have an issue in the States. We have a racism problem, and it needs to be fixed. So I'm going to go with the fact of how do you, as an African American woman delivering in the hospital, maybe advocate for yourself or identify if there are questions you can ask that are going to help set you up for a better experience, a safer experience? And I may not have a perfect answer for this one. I would love if you have any suggestions to throw those in the comment box down below and we can continue this conversation. I think there might be a YouTube video coming about this. We can talk about it. I would say that maybe it's not totally appropriate for your hospital tour, because for a tour, I'm thinking like, I don't know that there would be anything different about being a black mom or a white mom or an Asian mom or a, I don't know, who anybody else, Hispanic. It doesn't really matter on the hospital tour, but what matters is the care that you receive. And so I would actually think it's appropriate, you could do this on a tour, but with your provider, and then while you're in the hospital, to say something like, I hear that the statistics are poor for African American women. Let's just acknowledge that I'm an African American woman, and so how are you going to make sure that I don't become a statistic? Hello. I'd be like, what? If I'm your nurse, the other thing is you can say this at the bedside and just say, look, I want to be super candid and super open because I really believe we need to be having these conversations and not shying away from them and not being afraid of it. And so say, look, I know you're my nurse. I'm so glad you're my nurse. I'm having a lot of anxiety, and even if you're not having anxiety, tell them you're having anxiety, because it opens a door to the conversation of saying, putting it on you rather than putting it on them and accusing anybody of racism when you don't even know them. You're saying, hey, I've heard about women who are African American receiving poorer care and having a higher chance of death or complications. I'm really, really nervous about that. How can I set myself up? How will your care be as such to prevent me from becoming that woman or one of those statistics? And I mean, honestly, if I was asked that question by a patient, I'd be like, huh. And honestly, I don't really know that I would necessarily, what I would say. First of all, you'd be on my radar that like, you know that the statistics are bad. And if I had like some sort of internal racism, bias, whatever, which I don't think I do, but I would just say, you know what, my care is the same for everybody and I'm gonna give you the best care possible. And then you could say, if I'm sensing that there's like a racial issue going on here, can you be my advocate? Would you be willing to help me with that? And would you make sure that future nurses are? That would be super cool. Honestly, I would think that would be super cool. If I was your nurse, I'd be like, absolutely. And then guess what? It opens up a conversation and it opens up this like awareness in the room of like, it's not this elephant, it's this, okay, we know this exists. I'm not gonna be one of those women. You can calm down, and then your care team hopefully is giving you better care. And if there was a racism or a bias or something going on inside of them, they're like, ah, shoot, I've been put on the spot. And so they're paying attention to me. And so I better give really good care. I don't know if that's actually that helpful, but, and I don't even know if that's where you were going with this question, but I'm gonna go with it. And I hope that's helpful. All right, one more from Instagram, and then I gotta get to YouTube. _S_Frosty says, if you get an epidural and still need a few stitches, do they still need to freeze you or numb you, or do they just stitch as you can't feel anything because of the epidural? If you have an epidural, they do not need to give you anything else. It will cover the discomfort from a few stitches down in your vagina. Occasionally, you might need a little more epidural medication, which they can give you. If you needed local medication, or let's say you don't have an epidural, they'd numb you with local medication and inject like numbing stuff down there so you don't feel the stitches. We're gonna go to YouTube. Melissa Chavez says, I'm wondering if my labor will progress faster this time, even though my last experience ended with a cesarean delivery. I labored to 10 centimeters and pushed for 2 hours, but baby was not coming down. Do you think I'll go faster this time, even though it wasn't a vaginal birth? Flex and flow for sure. Now, mind you, this is a little bit of a preview for my VBAC class because I do talk about this and different factors related in my VBAC class, which you can find on my website. My answer to this would be, I would assume yes, that actually you would potentially labor like a second-time mom. The pushing may take you a little longer because your pelvis hasn't stretched or moved and the baby hasn't come out your vagina yet. But in general, you did labor to 10 centimeters, so your chance of going a little faster is higher. Flex and flow though, don't quote me on that one. This is not a question, it is more of a comment, but I'm curious to hear what you think. Casey says, please consider expanding your channel to include content related to postpartum life, early infancy, and beyond. So I wanna know if that's something you're interested in. I understand, like, once you have your baby, then some of this stuff doesn't become quite as helpful, and so we can talk about baby, we can talk about postpartum. If you have ideas for postpartum videos, for maybe breastfeeding videos, then throw them in the comment box down below. But I am considering starting a new series about postpartum, related to postpartum topics. Let me know if that's something that you're interested in, and we'll go from there. No questions, just really nice people. This question I get a lot on Instagram, particularly because I think there's a good amount of doulas that follow me over there. So maybe you're a mama that's thought about maybe doing birth work or helping moms through labor. Simone Jeanette says, I have a question a little bit different. I'm looking to change careers after my baby arrives. What certifications or education would I need to be a doula or a midwife, or just work with babies and pregnant mothers? Is being a nurse or a doctor the only option? Okay, this is a super loaded question, and I'm gonna summarize it quickly here, and then this could be a future YouTube video as well. There's a difference between a doula, a midwife, and a nurse. So a doula is a labor support person. There's somebody you pay that has some training in birth, that they help you emotionally and physically through your labor and birth. So they're there to help you know, like, yes, let's try this position. This is what labor looks like. This is normal. Let's maybe go to the hospital. Let me get you some water. Yes, you're doing okay. Helping you breathe, knowing what your options are, helping you advocate for yourself in the hospital setting. Now, to be a doula, there are lots of different organizations that certify. Unfortunately, there is not one certifying body like there would be for a nurse. The nurse is the Board of Registered Nursing. I had to take a nursing exam that was like the worst exam of my entire life that certified me as a registered nurse. So there is no such thing of that sort for doulas. Anybody can choose to be a doula. So you don't need to be certified to start working with mamas. I would highly suggest that you're certified, and if you're looking for a doula, to be looking for somebody who has some experience and who's done some training. And there's different training depending on where you're at in the world. DONA and Kappa are probably two of the bigger organizations that certify doulas, and I would say start there. There's also Birth Arts International. There's other ones out there. Potentially Bundle Birth in the future. Did I give that away? And so you can look into that. That would be an easy, quick career change. You're not gonna make quite as much money as a doula as you will as a nurse or as a midwife. A nurse typically has an associate's or a bachelor's degree. You're working in the hospital. So typically as a nurse, you would go to nursing school, get your RN license, that's 2 to 4 years, and then you'd take your exam, then you'd specialize in labor and delivery and work in the hospital setting. Could be a birth center, could be working with home birth midwives. Flex and flow, but it is actual schooling and a degree. The best part is though with that is you actually have the schooling, the certification, the medical background to be able to offer nursing education to people. Now, a midwife is one level above that, where they actually have a master's degree as a licensed midwife or a certified nurse midwife, and they're either functioning in the home birth setting, in a birth center setting, or in a hospital, and they can deliver babies. They can take care of healthy, low-risk pregnancies. Once you become higher risk, you do have to go to an obstetrician. They have a lot more schooling. Obstetricians have a ton more schooling than do a midwife. A midwife has another 2 to 4 years. And so, yes, they can take care of healthy pregnancies. They can't perform surgeries, and they're gonna pass you off if you become a high-risk pregnancy. So it kind of depends on what you're looking at in terms of what role you want to fill. If you wanna be labor support, if you wanna be there walking and holding the hand of pregnant couples, that's a doula. If you want to be at the bedside, at the birth, doing that every single day, helping them through, but you also have like an end time clock to clock out of where you're not working for 24 to 48 hours with your clients, that would be more of a nurse. And if you want to be fully responsible for the pregnancy and for the birth, actually deliver the baby, we're looking at a midwife. So that's the quick distinction. Actually, I think that was probably a pretty thorough distinction between the three. Let me know what you decide, and if you have any other questions about that in the description box down below. And good luck with your career change. There needs to be more of us out there that are offering support to mamas and baby. Maddie Tatum says, please do a video regarding the NICU. Doc says our baby is smaller than normal. She weighs 3.5 pounds and has a lot to do with me being only 5 feet tall. I'm 17 years old and 8 weeks left. Should I expect her to go to the NICU? This is a loaded question. I am not going to answer that question directly, but let's talk about the NICU real quick here. Little things about the NICU. 2 things I'm hearing. One would be gestational age. At what gestational age or what week in pregnancy does the baby go to the NICU? And then the other one has to do with a small baby. So the small baby one will be also a full YouTube video. Typically a baby that's going to be under 36 weeks will probably see the NICU. It's pretty rare for them to be not going to the NICU under that. Weight is super important. So even if your baby was 36 weeks, but if they weigh less than 2,500 grams or 3,000 grams, depending on what hospital you're in, they're probably gonna go to the NICU anyway. That's a better safe than sorry thing. Weight really does matter for long-term outcomes. We want them to be bulky. We want them to have some meat on them. And so if your baby's weighing 3.5 pounds, I'd have to look at a growth chart. I'm gonna assume that that's gonna be small for a 32-week pregnancy. That's gonna be on the smaller side. And so what we would call that is an intrauterine growth restriction. And so if the baby was born super duper small, that could send them to the neonatal intensive care unit. If the baby was born below 36 weeks, and sometimes even after 36 weeks, and even up to term, depending on what's going on with the baby, they can still end up going to the neonatal intensive care unit. And if the baby is IUGR or not growing enough or not growing anymore, that would mean likely that the placenta is not doing its job very well anymore, and our placenta is our baby's lifeline. So if baby's not growing, that means that there's something going on with our placenta that's not giving the nutrients to help our baby grow. Therefore, there's really no benefit for your baby being inside. That is also why a lot of times if baby's not growing, baby's not big enough, that you're probably looking at an induction of labor, because it's better safe than sorry. There's no reason for your baby to be inside anymore. They're not getting the nutrients that they need. That's a risk to the baby. Better for baby to be outside. That's my quick answer to that one. I hope it helps you with that. I would say to trust in your body, stay in really close contact with your provider, ask your provider that question specific to your pregnancy. They know you best. All right, I'm gonna go to most recent coffee and questions, and then I gotta be done. You guys most definitely want a preparing to conceive or a preparing for pregnancy video. I got you there. The Mrs. B13 says, I keep hearing people say interview your providers, but what does that exactly mean? Do I make an appointment and just ask a bunch of questions? When I make appointments, do they usually ask for the reason of the appointment, or do I just say interview? How does the whole interview process work? Love it. As you're looking for a provider, you do have a choice typically with your insurance. First of all, you want to make sure that they're a part of your insurance, and then as you're scoping out your providers, choose 1, 2, 3 people to interview. Yes, you're using the word interview. Some places are going to be more comfortable, more used to this. Here in LA, like you say interview, they're like, okay, sure, and they have like whole time slots for that. Whereas other places, they might be a little more like, huh? What? You're advocating for yourself and you're trying to figure out the right fit for you? That's weird. Call the office and say, hey, I'm looking for a provider. I'm not ready to establish care yet, but I would like to sit down with the doctor and interview them, ask them a few questions to determine if they're the right fit for me. So you're explaining what the process is, and you can say the word interview, and then if they do this, then they'll know what you're talking about. And then you set up 2, 3 interviews with people and you scope out what doctor is right for you. I gave you some criteria in a previous video I can link here above on how to choose a doctor, and I would highly suggest doing this because your provider makes such a difference. In my VBAC class, I just got through talking about how that is the #1 thing you can do to set yourself up, is have the right provider. And so you want to make sure you have the right provider. If you need tools for that, I talk about that in my childbirth classes. I talk about that in my birth coaching process, and we can do a one-on-one and talk about helping you find the right provider as well. Brittany Petty says, I'm 13 weeks pregnant and having horrible constipation. Any tips for dealing with it and hemorrhoid? Oh, first of all, I am sorry. That sucks. First of all, up your water intake. The more dehydrated you are, the harder your poop's gonna be and the more constipated you're gonna be. Increase your fiber intake. So fruits and vegetables, you gotta keep eating those. And then fiber is really good. Taking some flax, ground flax, not kernel-y flax. Kernel-y flax just goes through you, it needs to be ground. Also walking, being active active is also really important. You can also do abdominal massage. And so what you're doing is you're rubbing your belly, rubbing it in a circular motion to help stimulate the bowel. You can do that every night to help move that stool through. If you have a hemorrhoid, avoid straining. A squatty potty is a great investment for you to help with pooping. I have that on my Amazon list. I think it's on Pregnancy Survival. You can find that in the description box. Hemorrhoid creams like a Preparation H. You can actually put ice on your butthole. Or if it's that bad, go to your doctor and ask them for a specific prescription cream that will shrink the hemorrhoid if it's really that bad. They can do a hemorrhoidectomy where they like pop the hemorrhoid, but that's not ideal and risk for infection. Ugh, not fun. So let's try everything else. Now, some of that may not be avoidable. You are pregnant and the pregnancy hormones are not helpful for constipation / hemorrhoids, but I would say try all of those things and see, hopefully it helps. That is all I have time for today, guys. I am so grateful for all of you. If you haven't subscribed, go ahead and subscribe down below. If you have other questions, I would love to hear what your questions are. You can throw those in the comment box down below. Let me know if you have ideas for future videos, and then let me know which one of these questions was your favorite, because I may turn them into a quick reference FAQ video. Until next time, don't forget to flex and flow, and I will see you soon. Bye. Well, because otherwise it's not gonna happen. Don't judge me for the straw. Save the turtles. I was sweating balls. Oh, it's clockwise. This is clockwise, right? I don't know if it's clockwise or not. What is this? You're doing it. Whatever, rub your belly. Hallelujah. I know I'm yelling. I know I'm yelling. My back hurts. I gotta do water my plants. Oh my gosh, I love you, Lindsay. So much filming. This lipstick smells weird. I need coffee. I need coffee. I have coffee. Placenta. Whoa. I got a little excited about the placenta here. Oh, wow. Oh, wow. Oh, wow. Cat, cow. Not fun, but you're fun. Love you all, and good night.